ask, I mean, now that the COVID emergency, that the federal emergency has been declared over, um, is it more difficult to track cases? I know that me, just as a typical person living in Northern Virginia, it's a lot harder for me to find out what's happening with COVID in my community, because all the places that I used to go, like the New York Times and my local county government and the state, et cetera, the data that was available before, you know, isn't being tracked anymore. So do we have a good handle on where it is and how it's performing, and where should somebody like myself go to look for this information so I can make a decision? Should I wear a mask on an airplane? Can I go out to dinner? Should I, sort of stay home?
Right. So yes, it's gotten much harder to track COVID-19 cases. And that is a combination of the public health emergency ending. It's also about the way we were starting to test prior to the end of the public health emergency. So when we all transitioned to the majority of our testing being done at home with antigen tests, we were already seeing a really big difference in the way we could track numbers of cases. So we knew that that was a huge underestimate towards the last year before that public health emergency ended. So we already had some problems with that. It definitely got more difficult after states stopped reporting to CDC. CDC is still one of the best places to look, but our metrics have completely changed. So now we've got hospitalization rates, we have percent of deaths, and we've got vaccine numbers. We have some test positivity numbers as well, but those are people that are getting tested in hospitals or going to other units where they're getting a PCR test. And we already know that's going to be a biased sample of people who are more likely to have COVID. So it is not an apples to apples anymore. From here on out, it will be. So, fall of 2023 should have the same sort of tracking measurements as fall of 2024. So we should get to a place where it becomes easier to compare what waves look like. But back to your real question of what do you do as a person? Partly it is, how many friends do you know who say, I don't feel very well right now, or I'm going to stay home because I have COVID? And so if your social network is talking about it, there is more of it where you are. Another metric for this, and this is doesn't feel like a very scientific metric, but if your local pharmacies, CVS, Walgreens, wherever you go, is out of COVID tests, that means there's a lot of COVID going on in the neighborhood that you're in. And so those are kind of our newer measures. Our other one I will mention is our wastewater surveillance, which has been a really important new marker of that we've used during the pandemic. It had been used for some other things, but it really wasn't well socialized until COVID-19. It has been consistent and great, but currently there is a problem because there's a contract negotiation with 400 of the wastewater plants. And so there is missing data there right now that hopefully will be solved soon, but that went from being a good marker to perhaps a little bit harder to watch at the moment.